Although radical cystectomy is the standard of care for patients with BCG unresponsive, high-risk, non-muscle invasive bladder cancer, many patients are ineligible for surgery or elect for bladder preservation. This study was a single-arm phase 2 trial to evaluate the efficacy and safety of atezolizomab in BCG unresponsive high-risk disease. The two co-primary endpoints were pathological complete response at mandatory 6-month biopsy for patients with carcinoma in situ, or event-free survival at 18 months for patients with non-CIS tumors. Adverse event assessment was a key secondary endpoint. Overall, 129 patients were eligible for efficacy analysis, and of the 74 patients with CIS, 27% experienced a complete response at 6 months. The median duration of response was 17 months, and 45% of the responses were durable at 1.5 years. The 18-month event-free survival rate among 55 patients with superficial non-CIS disease was 49%, and overall, approximately 10% of the 129 patients experienced a progression to muscle-invasive or metastatic disease. Regarding the safety profile, 16% of patients experienced a grade 3 to 5 treatment-related adverse event, which included 3 treatment-related deaths. To conclude, the efficacy of atezolizumab, while comparable to other drug candidates, did not meet the pre-specified efficacy threshold. The study was limited by the small sample size and a high rate of patient ineligibility. And finally, regarding the systemic therapy in this context, modest initial efficacy needs to be balanced with a significant rate of systemic toxicity and the continued risk of disease progression even years after drug discontinuation.